Hi everyone, I am Dr. Isha, your companion from TTC to pregnancy. Today's episode is special because we are talking about a topic that is often misunderstood, but it's extremely important in the fertility journey, that is third party reproduction. And this includes your egg donation, sperm donation, and surrogacy. So, because there are new laws in India, there is also a lot of confusion among couples who are exploring these options. To help us understand these options in a better way, I am joined by Dr. Bhavya Jha. She is a fertility and IVF specialist with MS in Obs and Gynae and fellowship in reproductive medicine. She is also trained in assisted reproductive technology from Care Fertility UK. She has guided many couples through advanced fertility treatments. Thank you so much, Dr. Bhavya, for being with us today. Before we start, I would like you to give us a brief introduction about yourself.
Thank you, Isha, for this beautiful introduction. So basically, I went into fertility after my obs and gynae. This was something which was very personal to me, and also I would see in the medical college that there were a lot of patients who were suffering from fertility, infertility, but the kind of care it requires was not there. So we
Right,
were all involved in obstetrics and their management, and all the infertility patients just were mismanaged and not very well treated.
right.
So after my MS and my senior residency, I started learning about it and also did my fellowship in it.
Hmm.
And then I went to UK, Manchester, United Kingdom, and then I did my further fellowship from there.
Okay.
And now around 10 years into this practice, and specifically just practicing fertility and IVF. So
Hmm.
we are just seeing patients suffering from fertility day in and day out. So
Right.
that becomes a huge volume.
Hmm.
And from 5 7 years, I have been noticing that a lot of failure cases which are coming to me.
Yeah.
And they are even more difficult because they become high risk infertility patients,
Right.
so struggling with very poor endometrium or a very poor uterine cavity,
Yeah.
then recurrent implantation failures, and then
Hmm.
your gametes are not good enough, very low ovarian reserve, low sperm
Right.
count. So
Right.
these things become very challenging, and giving them pregnancy is what I love to do now.
Hmm.
So, and very humbly and proudly, I would like to say that I've been managing and giving results to such
Hmm.
IVF failure cases, and hopefully, I continue to do that.
Yeah, that's such a, great thing that you are doing for this world. And I think it's the need of the hour. So we really need, fertility specialists like you who have such a great experience and especially dealing with cases which are, as you said, they are high risk infertility cases, right? So yeah, I mean, it's an amazing job and I'm very happy to have you here on this platform. And I'm sure we are going to, talk a lot about this third party reproduction today. So before we start, I just want you to firstly explain the simple term. What exactly is this third party reproduction and in what situations is it recommended?
So basically, third party reproduction is when any couple who's trying to conceive, and that couple requires a third person to get pregnant. Now, what do you mean by third person to get pregnant? So that third person either donates her eggs, his
Hmm.
sperm, or becomes a surrogate to the couple. So when the third person is involved to help the couple get pregnant, that is called third party reproduction.
Right.
So if I break this into egg donation, sperm donation, and surrogacy,
Hmm.
obviously egg donation is for those people who have very low egg count, very poor AMH, and
Hmm.
with all kind of medications also we are not able to get required number of eggs, or the quality is very poor with advanced age and things like that.
Hmm. Hmm.
Then we use the egg donor.
Hmm.
And similarly, in sperm donor also, it's not that when the sperm is low, we jump in for sperm donation initially.
Hmm.
We give all kind of trials, to preserve the original gamete of the parent, giving all kind of drugs, injections, even use sperm retrieval techniques like TISA and PISA, and even if that is not successful, or there are multiple IVF failures,
Yeah.
that is the time when we have no option but to take help of sperm donor.
Yeah.
Similarly, in surrogacy, which is the aspect of third party reproduction,
Hmm.
one does not use, offer surrogacy in the first go itself.
Okay.
Multiple IVF trials are given. If it
Hmm.
keeps failing, then, we have to change the uterus. So
Right.
that is the time when surrogacy is used. And
Hmm.
indications of surrogacy we'll obviously discuss
Hmm.
further.
Hmm. Hmm. So usually this is the last resort for the patients, who have failed all the
Yes.
ways of, trying naturally or through their own
Yes.
gametes. Okay,
Mhm.
understood. And there is actually a lot of confusion about this, egg and sperm donation. So can you help us understand what is the current legal status in India about, this donation, who can donate and who is actually eligible to receive?
So, egg donation and sperm donation laws were drastically changed when the new ART bill came in
Hmm.
2022 and then 2021 and 22.
Hmm.
So, before it was much easier because it was not actually regulated. But
Right.
now a lot of rules have come in and we have to understand those rules. So, anyone can just not walk in and say that I want to donate my eggs. There is an age criteria. I'll first discuss about the egg donation part. So the age criteria of them is about 23 years to 35 years of age. So
Okay.
she has to be between that age group.
Right.
Then she can't walk into an IVF clinic and donate her eggs. She
Okay.
has to come through an ART bank, which
Okay.
is again registered under National Registry
Mm-hmm.
in India.
Right.
And the donor goes there, she's registered there, she's screened there. Once
Hmm.
she fulfills their criteria about
Hmm.
the age and their Aadhaar card, a lot of things are checked
Right.
medically if they're fit, and
Hmm.
all sort of screening process is done.
Hmm.
After that, they are recruited for IVF centers and we receive them from the ART banks.
Hmm. Hmm.
Then coming to blood tests, we cannot randomly choose any donor. So we have to be very thoughtful and very particular about this part because
Hmm.
we do not want any unhealthy egg to pass on to the
Right.
couple, right? So
Yeah.
all kind of viral markers like HIV, HbSAg, the sugar profile, diabetes, hyperthyroidism, hypothyroidism, and hypertension,
Hmm.
thalassemia. These are the things, that can be easily passed on to the offspring. So
Right.
these things are checked and then only they are selected. Once they come to the IVF clinic, we
Hmm.
look into the egg part also. Obviously, they are very young compared to most of the
Right.
couples. So
Right.
their egg number should be good and the quality and those things are taken into consideration.
Hmm.
Then they do not have any parental right on the child.
Hmm.
So there is an affidavit which is signed that they have to relinquish all parental right to the intending couple.
Okay.
So these are the things that is looked into.
Hmm.
For sperm donor, almost everything remains the same. Anyone cannot walk into a clinic and say I can donate. They have to
Hmm.
come through the ART bank,
Right.
and obviously the registration and the screening process is almost the same. All the blood tests and things
Hmm.
are taken into consideration.
Hmm.
If the sperm count is good, they
Hmm.
are redirected to an IVF center, and
Okay.
there we use their sperm for the couple.
Okay.
Um, yeah, and also after this new ART law, it
Hmm.
also allowed relatives to become egg and sperm donor. So
Okay.
so
That's
this was a question which used to always come up, ma'am, can my sister donate or my cousin donate and things like that.
right.
Before we were not allowed to do that, but
Right.
now it's allowed. But again, they have to come through the ART bank, and
Right.
process is the same.
Okay. Just
We
one.
cannot directly take them.
Yeah, just one question. As you said
Yes.
that, the relatives are also allowed. So in that case, also the ART bank will screen for all the diseases as you mentioned, like,
Yes,
leukemia.
everything.
They should also be
Yes,
absolutely healthy before they make up their mind for the.
exactly,
Okay. And these
exactly.
ART banks are located in all the major cities of India, or are there any limited cities?
Yes, so they are located in all major cities of India, and like in smaller places also. Like I also do my cases in a small city in Bihar.
Okay.
So the ART bank per se is not there in that city, in
Right.
that town, but
Right.
ART bank there is ART banks in Patna.
Hmm.
So, the capitals, all the capital cities have it, and then you can just register it from there.
Okay.
So
Okay.
it works like that.
Right. Right. And I think you were
And then
mentioning. Yeah. Yeah. Sorry. Please go ahead.
yeah, so coming to the recipient part, who
Yeah.
can become, the recipient of donor? That
Right.
was also your part of your question.
Yeah.
So generally for egg donor, it is poor AMH, low egg count, or the embryos that are forming are of very, very poor grade, multiple IVF failures. Then maybe the mother or the husband is, the wife or the husband have some genetic disorder, of
Yeah.
severe degree, and they don't want to pass it on to the
Right.
offspring. That is the time when you change one of the gametes.
Okay. Okay.
Um, and there is an affidavit which is formed between the couple and the donor. So
Right.
like I mentioned, where she relinquishes all her rights to the couple once the
Hmm.
baby is born out of it. And apart from that, it is the clinics and the intending couple's job
Hmm.
to provide a health insurance to the donor for
Okay.
36 months. Okay,
Okay.
so that post pickup, if she has any complications, that
Hmm.
has to be covered by the insurance. So we have to take care of the safety of the donor as well.
Hmm. Hmm. And who is bearing the charges of all this? The, egg donation and sperm donation, the
The
couple?
intending couple. So, coming to the charges, uh, donor is not compensated for, this thing.
Right.
According to the new law, she's not getting any monetary compensation.
Okay.
She
Okay.
has to do it willingly without any monetary compensation.
Even the egg donor.
Basic idea of this ART bill was that there should not be any exploitation of any woman.
Right. Right.
Okay, so that is explained in the beginning itself.
Hmm.
So, but the medical expenses and the medicines and takes
Yeah.
care of the post pickup issues and things like that.
Right.
As per, there is no monetary compensation.
Okay. Understood. So the couple has to bear whatever, the.
Yes, yes, the insurance cost and everything couple has to bear.
Okay, understood. So now that brings me to my third question, which is related to surrogacy. It is also another, aspect which couples are very curious, not just for the first baby, but sometimes, planning their second child also. But recently, I think laws have changed. So can you explain us how this surrogacy works in India and what are the new restrictions under this Surrogacy Regulation Act?
Yes, so surrogacy laws also changed drastically after 2021.
Hmm.
So, firstly, commercial surrogacy is not allowed in India. So, it's
Hmm.
altruistic surrogacy, where the surrogate again is not compensated. There's
Hmm.
no money given to the surrogate.
Hmm.
She's
Hmm.
doing it on her own will without any monetary
Right.
compensation. So, many a times, a couple bring their own surrogates,
Hmm.
maybe a relative or someone who can
Right.
help them out.
Hmm.
Sometimes sisters or such kind of people do volunteer.
Hmm. Hmm.
And again, their age group should be between 35 to 45 years of age,
Hmm.
not less than that and not more than that.
Okay.
And there is no monetary compensation, like I said.
Hmm.
But again, the couple has to pay for an insurance cover. Here
Yeah.
it is health as well as life insurance.
Okay.
Again, it goes up to 36 months of insurance cover. After
Okay.
post delivery, if there is any complication, that all has to be taken care of.
Right.
Then your medicines and fooding and everything that you can take care of,
Hmm.
and has to be taken care of by the parents itself,
Okay.
the intending couple itself.
Okay.
So coming to the exact to the criteria of surrogate, she should be 35 to 45 years of age,
Hmm.
and we do a lot of tests for them also.
Hmm.
She
Hmm.
should be fit for carrying the child,
Right.
all kind of diseases that can be passed on to the child or can complicate her health. Those
Hmm.
things are taken care of, and only those are selected who are fit for carrying the pregnancy. Then many a times, they ask us that will you be taking care of the surrogate for 9 months? Will you keep the surrogate for in the hospital for 9 months?
Right.
Initially, a lot of people did that, with the fear of for 9 months is a long time.
Hmm.
But nowadays, the laws tell us to let them be at their own home. They have their own kids and everything. So
Yes.
the surrogate is also comfortable. But
Right.
yes, the agents from the ART bank, they take care of, they're coming and visiting us every month for
Hmm.
medicines, for scans and things like that, that
Right.
we take care. Or even the intending couple can bring them to the clinic every month for a checkup.
Hmm. Okay. So
Then, yes.
yeah, yeah. Just one question was coming to my mind since you were saying the couple can also bring the surrogate to the clinic and but for egg donors, someone who is donating the egg or sperm, they cannot meet the couple, right? Like their identity
Yes,
is
so
not
basically,
revealed.
yes. So for surrogate, it's completely okay. Many parents are in touch with the surrogate,
Hmm.
okay? But in case of donors,
Hmm.
so in donors, we do not allow them to meet, and legally also,
Okay.
until and unless there is some reason, where they have to find out where was the cause. Well, I mean, if there is some disease or anything that is found out, and we have to find the exact donor, and the blood testing has to be done, and things like that. If there is
Hmm.
a medical issue, then only we make the parent and the donor meet. Otherwise, it is not allowed.
Okay. Okay.
And also not ethically, it should not be done. The donor always knows,
Hmm.
her child is gone to which couple and things like
Yes.
that. So that
Yes.
should be avoided.
Right. And other thing is, can like for surrogate, as you are saying that,
Yes.
she can lend her uterus to the couple, right? So can she also
Yes.
become a surrogate wherein she's also giving her own eggs? Like for IVF, her own eggs are utilized. So is
No,
that
no, no,
bit-
that is not allowed.
okay? So she's only lending her uterus for,
Hmm.
nurturing the
Hmm.
pregnancy.
Yes, only lending a uterus for surrogacy. Same
Okay.
surrogate cannot give her eggs. That's not allowed.
Okay.
And also coming to eggs,
Hmm.
according to the ART law, uh, when surrogacy is done, the egg should be from the husband, and egg should be from the female, and the sperm should be from the male who is coming for the treatment.
Okay.
But in some cases, when there is advanced age, or egg is very poor and things like that, or the sperm is very poor, they have to go to the surrogacy board, or
Okay.
appropriate authority, get permission from them for
Okay.
sperm donation or egg donation, and
Okay.
then only we can do donor egg surrogacy or sperm donor surrogacy.
In
Otherwise, according to law, eggs should be from the parents itself,
okay. Okay.
egg and sperm.
That makes sense. That makes sense. Okay.
Mm.
Now, talking about, the medical and legal aspects, right? So this is again another dimension which couple has to go through. But there is also an emotional aspect, right? So how can these couples prepare themselves, like emotionally, for this third party reproduction? Because there is a lot of social stigma, there is a family pressure. So what do you suggest in that situation to these couples?
See, anyone who's opting for third-party reproduction, taking eggs from, the donor or sperm donor, they are not happy with it at all
Hmm.
initially.
Hmm.
So when the journey begins, most of them are reluctant,
Right.
and of course, it's understandable.
Hmm.
But generally, like we have discussed before also, they
Hmm.
go in for donation, gamete donation, or surrogacy only when they have actually lost many battles.
Right.
So when self egg cycles have failed, and if there is no sperm at all, and there is no sperm in the retrieval procedures also, that is the time when we have to explain them. And then mostly with so many failures, they do agree to that.
Right.
And similarly for surrogacy also, surrogacy is, we'll discuss the indications. Surrogacy is not indicated for any random couple. When there are a
Okay.
lot of IVF failures or some very important causes, then only we can allow them for surrogacy.
Okay.
So first thing, acceptance is the
Hmm.
key. First, you have to accept, yes, there is a major issue. I've tried plan A, plan B, plan C, none of it has worked. Now I don't have an option, I have to go. Once
Right.
you accept things in life, then only you can come to the solution. Okay,
Yes.
so now this is the solution. I have to go for it because I want to progress in life. If
Hmm.
this is not working, now I have to go to the next step. So
Right.
acceptance is very important. Coming to, one more thing which plays with or plays on their mind is, the child will not look like me, the child will not have a genetic link to me. That is something that hits them a lot.
Right.
So yes, I agree. If it's a egg donor, the child will not have your
Hmm.
genetic. If it's your
Yes.
husband's sperm is not there using donor, it won't have a link. But then, if you look at the bigger picture, then
Hmm.
at least the child is linked to one of the parents. You are
Right.
going to carry the child. You are
Yes.
going to give birth to the child. So
Hmm.
and then you are going to nurture the child later. So
Right.
the environmental factors play a very, very important role in what kind of personality the child is going to
Absolutely.
develop, person the child is going to develop into.
Absolutely.
Look, coming to the looks and the features which is important. And most of the IVF centers are very sensitive towards it. If it's
Hmm.
a fair couple, we look for a fair donor. If it's a wheatish, so these things, the height and these things we do look into. At
Okay.
a personal level, I'm very sensitive about it.
Hmm.
I try to match
Hmm.
the donor completely to the couple, because I'm not giving an object. I'm
Okay.
giving a life. The
Right.
child will feel completely, out of place if something goes wrong. So these
Right.
things I look into very carefully. And most of the, like, answering this question, I think of so many patients, their memories are flashing, because I have seen their journeys. I have seen their first visit where they used to be so reluctant. Ma'am,
Right.
donor nahi chahiye, nahi chahiye, nahi chahiye. And today
Hmm.
they send me videos and photos of that same child whom
Hmm.
they are like living for now. So,
Yes.
it's just a passing process, I mean,
Right.
phase. It's
Right.
not for lifelong.
Right.
And also about coming to the societal pressure.
Hmm.
So when you're going for egg donation or sperm donation, I always tell my patients, किसी को नहीं बताना है.
Ah.
It's between you, your husband, and
Right.
your doctor. No
Absolutely.
मम्मी पापा भाई बहन, किसको किसी को क्यों बताना है.
क्यों
So
बताना है?
donor part, you don't have to discuss. It's your life. You're going to nurture the child, and you
Yes.
know what you have gone through to come
Right.
to this, right?
Right. Right. Right.
And the surrogacy part, of course, you cannot hide it.
Hmm. Hmm.
Surrogacy is something which cannot be hidden because you are not carrying the child. So
Yes.
again, someone who is going for in for surrogacy must have had multiple IVF failures, no uterus, things like that. So
Right.
you can't keep living for the society. You have to live for yourself.
Hmm.
And what you have gone
Yes.
through, society won't understand. So I think you have
Hmm.
to surpass these things at some point
Hmm.
in your life. Also, we
Right.
learn so much from our movies, right? I
Hmm.
mean, so many bad things we take from our celebrities. I think this aspect we can really take the good point from from our celebrities. So
Yes.
there are so many examples from our Bollywood who have had surrogacy, child through surrogacy.
Right.
So do they look different? Is there less
No.
love in their family? I don't think so. So we can
Yeah.
always learn and accept things.
Absolutely. And other thing is what I
Yes.
tell, to my, companions who have been part of my coaching program, that, a child decides the way and time they want to come to your life, right? So if they want to come through natural conception, or if they want to come through, IVF, or even if it is through surrogacy or adoption, whatever it is, they have destined their way. So you have to,
Exactly.
you have to
Yes.
remove any blockages you have in your mind and heart, and be open to, giving love and receiving love. That is the main purpose of being a parent, right? So yeah, I think you have
Exactly.
also said a very beautiful thing, that acceptance is important. And the child will obviously be nurtured by you. You will be nurturing the entire pregnancy if there is an egg donation, and that is also a blessing of the God. You're giving birth, you're experiencing everything, all that hormones, being a mother. So yeah, the child will always be yours. So that's a beautiful thing to say. Now, the last question, Dr. Bhavya, is, for someone who is considering surrogacy, what are the medical and personal factors they should, consider while taking this decision?
So again, surrogacy is not allowed for everyone.
Yeah.
There are very strict criterias.
Hmm.
According to laws, I will just discuss a few criteria. Like
Okay.
no unmarried person, no unmarried man can become can opt for surrogacy. A
Hmm.
single woman who's married or later divorced or widowed, she can opt for surrogacy. Then they should be from Indian origin.
Hmm.
If they are NRIs or OCIs, they can come through appropriate authority and opt for surrogacy. No
Okay.
foreigner national can opt for surrogacy.
Okay.
And like I had already discussed, they should have one gamete. I mean, ideally two gametes, both the gametes from the parents. If
Right.
not, at least one gamete should be from the parents.
Right. Right.
And one more point here is
Hmm.
that if you have a child of your own
Hmm.
or adopted your first child, if you have, you
Okay.
cannot go in for surrogacy for second child. The
Oh.
law does not allow.
Oh. Okay.
Yes, so this is something they come for कि अब एक बच्चा है हमारा and now we want to go for surrogacy, we are not able to conceive, so you are not allowed surrogacy until and unless that first child has some deadly disease, life-threatening disease, or a mental illness which is uncurable.
Hmm.
Then
Okay.
now, someone who's opting for surrogacy must be having a lot of issues. The
Hmm.
common ones are absent uterus or a
Hmm.
very hypoplastic uterus. Then
Okay.
there are conditions where there is primary amenorrhea.
Hmm.
The woman has not bled only since
Ah,
puberty.
right.
So that is primary amenorrhea. In those cases, again, the uterus is very small.
Hmm.
Then there are other uterine factors like multiple fibroid uterus.
Hmm.
Many times surgeries have been done, but it's kind of uncurable. There could be septate uterus, cutting the uterus into half, making the uterus very small. Then
Hmm.
there could be, multiple cases of thin endometrium, where the
Hmm.
endometrium does not go beyond 6.5, and that causes a lot of IVF failures.
Right.
Then there are cases where conception is happening, but multiple times their pregnancies are lost, maybe in the first or second trimester.
Right. Right.
Then there's short cervix, incompetent cervix. As the patient enters 5 to 6 months, they abort.
Hmm. Hmm.
The uterus is not able to carry the child further.
Hmm.
Then there are other medical conditions, like some life-threatening conditions, like the patient has cancers
Okay.
or any severe degree of sugar, diabetes,
Right.
hypertension,
Hmm.
kidney issues,
Yeah.
when the mother is not able to carry the child.
Right.
So I'll just walk you through how the process goes.
Okay.
So these are the main indications how in which we can allow the person to go for surrogacy. So
Right.
if a couple walks in the clinic for surrogacy, we check all these criteria and all the issues and everything. We document everything. Then
Hmm.
that couple is sent to the surrogacy board.
Okay.
So every state has a appropriate authority or a surrogacy board where
Hmm.
they have to go with the clinic's papers.
Okay.
There they will check all the papers and the indications and everything and the history, and then
Okay.
they give permission to go in for surrogacy.
Okay.
That is the time when they have to look for a surrogate. It could
Hmm.
be a relative or a family member or
Hmm.
anyone who is willing to become their surrogate
Hmm.
without any monetary compensation.
Right.
Then they come to us. Those tests are done. The surrogate is examined and everything. When we find a surrogate fit for going in for surrogacy, then we send them back to the court, or the whole legal process takes
Yeah.
place.
Yeah.
Sometimes they have to take help of the legal aid also.
Right.
And finally that surrogate is also interviewed by the surrogacy board and things like that.
Okay.
And when they give the final permission that this surrogate is fit and these parents do require surrogacy, then
Hmm.
we get the final papers from them.
Okay.
And that is the time when we start our surrogacy process. If
Okay.
the surrogate becomes positive after IVF, then
Hmm.
every month we take care of their medical and others
Understood.
issues.
Okay.
Once the child is born,
Hmm.
the birth certificate is in the name of the parents.
Right, right. Okay. So I think this is a very elaborative, the way you have explained it to us, it's very elaborative. And I think I'm sure it's going to help many couple understand their options in a better and feel more confident about making, informed decisions. So thank you so much for shedding light on this very sensitive and important topic. So just two more questions quickly I want to take from you. These are from the followers because I've asked them. Dr. Bhavya is joining us and we are having this discussion. So the first question is egg donation available in all fertility centers? Like, for example, all fertility centers can accept egg donors, or are there only limited options?
So, most of the IVF centers do egg donation cycles, which is very common because many people do require donor cycles. But again, it's through the ART bank. Most of the centers are associated with couple of ART banks through which they get donors,
Hmm.
like AIMS,
Yeah.
All India Institute.
Hmm.
They do not do donor cycles.
Hmm.
You know,
Hmm.
that's very surprising for them. Managing the donor part and all becomes very difficult. So there are a couple of maybe government centers which are not doing donor cycles, but
Okay.
most of the private centers are.
Okay, it makes sense. And the second question is, what to consider from donor for egg donation, like their health, hormones, age. So I think you answered it briefly in our conversation that yes, we have to consider many things. But do you want to conclude this particular question?
Yes, so I mean, when we are not taking the eggs from the couple, from the woman couple herself, and we
Right.
are selecting the donor, we have to look into all aspects, her health. Obviously, all kind of blood tests are done, and once that is clear, hormone, of course, is important because if hormones are in the right place, then only she will have good number and good quality of eggs. That
Mm-hmm.
is taken care of. I mean, discussed this briefly. And what was the third thing?
I mean, she wants to
Health.
know, yeah, the second one, first was health, then hormones, and then last is age.
Yes, age. A donor can only donate between 23 to 35 years of age, but we prefer to take our donors between 23 to 30 years of age
Okay,
because they have better quality of eggs.
right, right. Okay. Thank you. Thank you so much for, answering these questions, Dr. Bhavya. I am sure this conversation is very helpful. And to everyone watching, if you think this was helpful and it has made an impact, I want you to share it with someone who might get benefit from this. And don't forget to like, subscribe and follow for this expert interviews. And if you are based in Gurgaon or nearby areas and want to get in touch with Dr. Bhavya, don't forget to message me on Instagram and I will share her contact details with you. So, any concluding words from your side, Dr. Bhavya?
Infertility is a journey and we must not give up. We have multiple options. Please don't give up. Yes, it does fail at times, but finally, for 95% of the people, it does work out. Some way or the other, it does.
Okay, great. Thank you. Thank you so much, Dr. Bhavya. Looking forward to more engaging conversations with you and have a great day ahead.
Thank you, Dr. Isha. Thank you so much.